Namaste. Welcome to the Pan-India Legal Literacy and Legal Awareness Program initiated by the Department of Justice, Government of India, and is being implemented by Center for Environmental Education, Research and Advocacy, CEERA, at National Law School of India University, Bengaluru. I am Diana John. I work as an independent researcher, advocate, and work to promote legal education and awareness in nationally founded medical associations and internationally founded non-profit associations. Today is 26th of June and is observed as the International Day Against Drug Abuse and Illicit Trafficking. What is this day about? The United Nations organization every year observes this day to spread awareness about the serious issues and repercussions of drug abuse all over the nations, and also spreads a message to achieve the goal of a sustainable world free of substance abuse. Every year, the United Nations adopts a theme for this day, and the theme for 2022 is Addressing Drug Challenges in Health and Humanitarian Crises. The United Nations Office on Drugs and Crime, UNODC, is addressing transnational drug challenges stemming from situations of crisis, particularly in war zones, the refugee camps, and communities torn apart by violence. And what do we do on this day? The United Nations releases the World Drug Report. It contains statistics and facts which are taken from verified official sources, collected based on a scientific approach and research. And the United Nations in 2022 has also started a campaign, Care in Crisis. This is done in the aftermath of the war in Afghanistan, Ukraine, etc. Nationally, several sports competitions are organized. Cycle rallies are organized under the aegis of NGOs, urban local bodies, and involving community participation. Several literacy and awareness programs are also organized on this day. Research findings relating to drug abuse and substance abuse are published, and seminars are also organized. Known facts about drugs are also shared from verified official sources. And we also seek practical legal and environmental solutions to drug abuse in a country on this day. Everything has its own origin. The birth of June 26th owes its origin to the United Nations Resolution number 42 of 112, dated 7th December of 1987. The United Nations also has some conventions regarding the same. The Single Convention on Narcotic Drugs in 1961, the Convention on Psychotropic Substances of 1971, and the United Nations Convention Against Illicit Trafficking in Narcotic Drugs and Psychotropic Substances Act 1988. India is a signatory to all these conventions. Now, we in India also have applicable legislations to counter, fight, and address the issues of drug abuse. One is the Narcotic Drugs and Psychotropic Substances Act of 1985, and the other is the Prevention of Illicit Trafficking in Narcotic Drugs and Psychotropic Substances Act of 1988. The Act of 1985 has been amended in 1989, in 2001, and in 2014. The reason being that it was realized over time that drug abuse is not just a crime, but is an issue of deep concern that affects the family, the society, and the nation at large. The Act clearly defines narcotic drugs as to include opium, cannabis, poppy straw, and the like, and psychotropic substances as synthetic and semi-synthetic material, and even amount of salt that is used in excess. The Act provides for violation of its provisions and punishments for the breach and violation of orders, the illegal export and import, and the possession of narcotic drugs and psychotropic substances, and so on. The offenses under the Act turn to be cognizable, meaning clearly identifiable, and even non-bailable, making this a very serious offense. The offenses are punishable with rigorous imprisonment and fine, and depends upon the quantity that is possessed by each person. Suppose it's a small quantity of less than 1 kg, the punishment is different. It could be up to 6 months and fine up to 10,000 or with both. And if the quantity changes to the commercial or more than commercial, then the extent of imprisonment and the fines would go up. But now recently, there have been recommendations for change in this legislation by the Union Ministry of Justice and Social Empowerment. The recommendation is in such a way that a more humane approach is needed to avoid prison for these people who are drug addicts, because they are more of victims than offenders. And decriminalizing possession of small quantities for personal consumption is also a change that is being suggested. Now, this amendment to the NDPS Act is mainly done to treat those who are dependent on drugs should be treated as victims, and they should be not sentenced to imprisonment, but rather be given a way for rehabilitation and change in future. That is, saving, not punishing, is the motto of these recommendations in the legislation. The infrastructure and personnel in India. We have the Narcotics Control Bureau, established in the year 1986. It is a chief law enforcement and intelligence agency that works to enable the full implementation of the NDPS Act and to fight its violation through the Prevention of Illicit Trafficking in Narcotic Drugs and Psychotropic Substances Act of 1988. Then we have the National Institute of Social Defense, working since 1975, and is working through its autonomous division, the National Center for Drug Abuse Prevention, and is currently implementing the scheme of prevention of substance abuse through the NAPDDR scheme, that is National Action Plan for Drug Demand Reduction in 2018 to 2025. While the law is a temporary relief, we have several challenges to curb and manage in this drug menace that we face. This is owed mainly to the large number of drug users in this country, so that it makes it very difficult to identify them. In addition, tobacco is a drug that is legal. It's a legally available drug in the market, and it stays as an open threat. Then there is a lack of availability of rehabilitation centers, and the lack of the required kind of treatment all add to the problem. And a country like India, sharing its borders with almost 5 other countries, makes it easy for cross-border smuggling of drugs, which is also sadly aiding to the substance use in this country. And the COVID-19 pandemic has triggered a lot of factors that aggravated and worsened the condition of substance users in this country. The pandemic was characterized by depression, mood swings, and it has caused a lot of relapse in patients who were under treatment. It has changed the social and economic makeup of the country also. And so access to treatment were denied. There were restrictions and limitations on physical access to treatment as well that worsened the condition of substance users in this country. But not all is lost. We do have measures to prevent and curb drug abuse in this country. We need to give an awareness at the school level with more community participation and involvement. And we need to shift our focus onto the marginalized groups. And make sure to remember to share only known facts about drugs from verified official sources. Plus, we should also engage more youth, adults, and children in sports events to distract their minds into such, and they don't get distracted into the negative side of the drug mafia. And also organizing mental wellness courses and yoga would go a great way in achieving this goal. At the governmental level, we also have helplines. The Ministry of Social Justice and Empowerment of the Government of India has set up a national toll-free number, a drug de-addiction helpline number that has been effective since 1st of July 2015. This is mainly to help the victims of drug abuse, their family, and even the society at large. And as you can see, the helpline number 1800-110031. This has been made functional on a 24 hours into a 7-day basis with effect from March 2017. Legal aid is a great boon to substance users, mainly because any person who is an addict or a drug or substance user is usually considered as a person having a criminal mind, and he is considered as a person who is capable of committing offenses. Instead of understanding the mental condition, people isolate them from society, and so that leads to their worsened condition. The National Legal Services Authority Act of 1987, Section 12 states, persons who suffer from mental illness are eligible to free legal aid from the lowest court to the Supreme Court of India. But can we say that a drug abuser or drug user is a person who suffers from mental illness? Yes. The Mental Health Care Act of 2017 states that any mental condition due to abuse of alcohol or drugs have been included in the list of mental illness. And so any mental condition in a person that is arising from the use of alcohol or drugs are eligible to free legal aid in our country. NLSA, the National Legal Services Authority, is trying to focus on the problem of eradication rather than punishing the victims. Pro bono lawyering, a new welcome change for the public good. The Constitution of India, by virtue of Article 39E, directs the state to provide free legal aid to the poor and weaker sections of society. And this direction is given with an aim to promote justice on the basis of equal opportunity. The Department of Justice, Government of India, has initiated a scheme with the task of linking all those who are in need of legal advice to those lawyers who are willing to provide it. The name of the scheme is Nyaya Bandhu. And a welcome thing is the Legal Services Clinic at the National Law School of India University has joined the Department of Justice's Pro Bono Club scheme, Nyaya Bandhu. We also have Pro Bono India, which is a website that provides for interlinking of advocates with people, and it also offers internship called the Pro Bono Club. Those are for lawyers in the making. And as we conclude for today, let's remind ourselves gently that what we stop today saves our tomorrow. And at this moment, I take the opportunity to express heartfelt gratitude to the Department of Justice, Government of India, for the enabling platform, and for the Center for Environmental Education, Research and Advocacy, National Law School of India, for the implementing platform, and to the viewers and supporters of this video for their feedback. Thank you. Namaste.